What is autism and what does it mean to be on the spectrum? Autism or autism spectrum disorder is a lifelong developmental disorder that affects a person's ability to communicate, form relationships, and respond appropriately to the environment. ASD refers to a broad range of symptoms that is a result of a neurological condition that impedes normal development in the areas of social interaction and communication skills. Children with autism do not process their environment in the same way a typical child would. We know that there is not just one type of autism, but many subtypes influenced by a combination of genetic and environmental factors. Autism is characterized as a spectrum disorder because the symptoms and characteristics appear in a variety of combinations from mild to quite severe. These may include impaired communication and social skills, repetitive behaviors, unusually strong attachments to objects or special interests, resistance to change, extreme sensory sensitivities, and anxiety. Some people with ASD may require significant support in their daily lives, while others may need less support and in some cases live entirely independently. In 2018, the Center for Disease Control determined that approximately 1 in 59 children is diagnosed with ASD and seems to affect males more than females regardless of ethnicity or socioeconomic status. 1 in 37 boys are affected and 1 in 151 girls are affected, meaning boys are 4 times more likely to be diagnosed with autism than girls. Minority groups tend to be diagnosed later and less often. There is no medical detection for autism. An estimated one-third of people with autism are nonverbal. 31% of children with ASD have an intellectual disability with significant challenges in daily functions. 25% are in the borderline range. Nearly half of those with autism wander or bolt from safety. Nearly two-thirds of children with autism between the ages of 6 and 15 have been bullied. Nearly 28% of children with ASD self-injure. Head banging, arm biting, and skin scratching are among the most common. Now that we know what it means to be diagnosed with autism and how it affects our community, let's talk about understanding how the difficulties associated with ASD manifests in the educational setting. The school environment can pose unique challenges for students with autism. The sights and sounds of the hallways, the noise and commotion are often overwhelming. This causes stress and anxiety. It is important to create a supportive learning environment where essential information is accessible. It is important to spell out the school culture, what and when things are expected of them. The challenges posed by the new environment often seem overwhelming. They now must deal with many different teachers. They have to understand all the different rules, how to move from class to class, what materials are needed for different classes, and so on. Additionally, there is the added stress of being in the crowded hallways and lunchrooms, socializing with other children. This can be stressful for a typical child. Now imagine what it must be like for a child who is on the spectrum. Academically, some students on the spectrum are more adept and are extremely capable, and because of this are often included in the general education classroom. However, these kids still exhibit many of the common characteristics associated with autism that may make it difficult for them to navigate their social environment. More difficulties may arise when students with autism have extreme sensory sensitivities. Sensitivities to the environment being overly distracting, such as the hum of the computer or feeling overwhelmed by a particular odor. Some students have hearing so acute they can hear the sounds of construction 3 blocks away. They may be distracted by the mere sound of pencil on the paper or the turning of pages in a book, at times making it difficult for them to stay calm, to regulate their reactions while attending to the academics that are going on in the classroom. Organization of materials and the sequence of what they have to do is challenging. Their anxiety level can be very high when they feel like they are confronted with a lot of numerous information at once. The more they fall behind in tasks and the more they get distracted, the more anxious they get, which then leads to the potential for behavioral problems. These escalating stressors can lead to sudden and challenging behaviors, what is commonly referred to as meltdowns. These can range from yelling and screaming to violence, even from children who are not typically violent. Meltdowns occur when situations, tasks, or stimuli overwhelm a student's ability to control their anxiety, and for many it starts with being unaware of their feelings and emotions. Once they become upset or overwhelmed, they have difficulty calming themselves down. It is important as counselors to realize that these meltdowns are not deliberate and not directed at the counselor, the teachers, or the students. Meltdowns are a way of a student with autism to simply release pent up frustration. Many things can cause a meltdown: lack of predictability, participation in social situations where the child does not understand what they should be doing, not being able to get assistance when needed, and getting too much or too little sensory stimulation. It is important for the counselor to maintain calm. The most important things we as counselor can convey to teachers of children with autism is to know the warning signs. Promptly intervene with the distraction or calming techniques to help the student gain control before the onset of a full-fledged meltdown. This is where the individualized education plan accommodations are essential. The need for counselors to fully explain them to teachers at the start of each academic year and to revisit regularly as the year progresses. The teachers have to know what this student needs. A calm down plan must be set in place for the student to regain their composure. Without this plan, students will inevitably enter the meltdown stage. Loss of control that can be dangerous to everyone present. When a meltdown occurs, there must be a plan already in place so teachers know what to do, what supports are in place, and be ready to act. We as counselors must create a workable plan for teachers to follow. Having a plan is critical to help a student who is suffering from a meltdown regain control, because this is hard for the child to recover from. The recovery stage. Recovery means that the behaviors exhibited during the meltdown stage are no longer occurring. However, the child is still fragile, and if predictability does not return, they may melt down again. There is no on and off switch. Once in the recovery stage, kids need help easing back into their routine. The counselor can facilitate this by engaging the child in highly motivated tasks that they can accomplish related to a special interest or one that plays to a particular strength. Once the child is calm, it is up to us as counselors to process the meltdown with the child, to understand why this happened and develop a plan to avoid this in future. It is important to ask the child, where did we make mistakes? Making it very clear that it is not just them that made mistakes, but our inability to understand their processing and adapt, to help them cope with their emotions or stimuli. After processing the event with the child, ask them what they need to avoid this kind of stressful event in future. Discuss it with the teachers and stick to it. A strong line of communication with the parents or caregivers must be maintained. We will get to know the children through them, and they will get to know what is expected of them at school through us. This is incredibly important. Ask them about the strategies that work best with their child to understand their feelings and to manage their behaviors. While some older kids may have already developed healthy coping skills, it is important to build on that. As we all do, people who are on the spectrum evolve and change, and so their interventions must accommodate for that. Creating optimal learning environments for students with autism, the individualized education plan. The IEP is the central document that serves as a roadmap that should include the characteristics of autism, helping teachers to create a successful learning environment, and managing behavioral challenges that may arise. The IEP should lay out the child's present skills, the things that they should be working on, and the support that ensures that they are followed through. The goals, what we want them to achieve, and what they need to achieve this. The IEP must also address the specific strengths and needs of a student, including types of motivating reinforcement, classroom supports including sensory, social, and communication support, and/or modifications that will help them learn best during each class. The IEP should structure the learning process to ensure the student is reaching their full potential. This will increase the student's ability to navigate the school environment with success and independence. It must be explained to teachers in a way that will make them understand that although following a student's IEP may initially be extra work, the benefit would far outweigh the effort. That if they do not follow the IEP as outlined, they will be tied up dealing with behavioral issues that are considerably more effort in the long term. A special education teacher or instructional aide may be assigned to assist the general education teacher through direct classroom instruction to help find creative modifications in the curriculum. They can also help with making the IEP as useful as it can be to keep the child focused on the general education teacher and to make modifications as necessary to achieve their goals. Make sure the student is on task and has the materials and reinforcement support needed. These aides are the facilitators in the classroom and are essential. These children can contribute to the classroom experience just like any other child if the proper plans are put in place and are met. Although no two students with autism are alike, it is true that all are most likely to thrive when there is consistency and predictability. Every aspect of their school life needs to be explicitly spelled out, verbally and in writing, structured and consistent, so they can have the predictability needed to have a productive and rich school experience. There are differences in every child diagnosed with ASD, and it is important to embrace the differences. A child with autism can expand our way of thinking if we listen. Children with autism spectrum disorder are different, not less.